Hello, today we're going to be talking about the lungs, and we will be making a lung model. And for that, you're going to need some balloons, like I have here. You're going to need straws, you're going to need a bottle, tape, scissors. It's pretty simple. So, what we're going to do is we're going to get a big, large balloon, cut the top off, and that will become the bottom of the bottle. This is going to be our diaphragm. Then, small balloon, you're going to insert a straw in there. You're going to tape it. You're going to do this twice, and this is going to become our lungs, and it's taped. Then you're going to get the cap and drill a couple holes and run your straws through it, and it goes in the bottle like so. And this is our lung model. And the way this works is, I said this bottom piece would be our diaphragm, and respiration works in two ways: is inspiration and expiration. And when the diaphragm and the intercostal muscles expand, it pulls air into the lungs, and when they contract, then they release that air. It takes energy for the to inhale, but it does not take any energy to exhale. And what happens when you're doing that is air is coming into the lungs and is bringing oxygen with it. And when you exhale, you're doing away, getting rid of the carbon dioxide that is a waste product of us breathing, and the cells using using oxygen. So air enters the respiratory system through our nose, through our mouth, and passes through the pharynx, down the trachea, and then it splits into the two lungs. The air travels down, like I said, the trachea. The right lung is composed of three lobes, and this is the structure of the lungs. We have the left lung and the right lung. So our right lung would have three lobes. This one would be composed of two lobes because the heart takes up a space on the left side of our torso. And then it goes from the trachea to the bronchus, and then the bronchus to the bronchioles, all the way down to the arterioles, which is where the gas exchange happens, and that's where the blood comes in contact with the bronchioles. The blood is bringing back, the oxygenated blood is bringing back the carbon dioxide, picking up oxygen, and then as we exhale, we get rid of that oxygen, and so we inhale, we bring that oxygen, and then it gets put back into our blood and then sent all the way to every part of our body. And that's the process of breathing. There is different lung capacities for different people, and this is dictated by the size of the person. Depending on how big you are, you're gonna need more air, depending on your size. Also, depending on where you live, if you live at a higher altitude, you will have a larger lung capacity because you will need to breathe in more air, because air at a higher altitude has less oxygen. So therefore, you need a bigger amount of air to have enough air to supply every part of your body. Also, there is other factors that contribute to it. Is lifestyle. Do you exercise? Do you have a sedentary lifestyle? Are you a smoker? Are you obese? What is your lifestyle? What are you exposed to? Do you live in an area where there's a lot of dust? Do you live in an area that is highly polluted? Do you have any illnesses, any diseases, lung disease, COPD, asthma? All these things play a role into your lung capacity. One of the things that we look at is, what is asthma? How does asthma affect the lungs? And asthma can affect the lungs by having an asthma attack, it reduces the airways going into the lungs. So if you see here, we have an example of a normal airway. We have an example here of somebody that's experiencing an asthma attack. When you're experiencing an asthma attack, there's a lot of restriction that happens inside the airway because of swelling and mucus secretions that happen because of the inflammatory response that your lungs have as they are exposed to whatever triggers that asthma attack. So it's in your upper respiratory system where it happens, and you're gonna be exerting yourself to breathe. And as you breathe, there's gonna be some wheezes happening because your bronchus are or bronchi are restricted, just like you see here. This here is a cross section of a normal airway. See how open it is? This is a cross section of somebody experiencing an asthma attack. What are the priorities for managing a person with asthma? Some of the nursing priorities would be getting this person to a normal O2 saturation. If the O2 sats are low for this person, then we're going to get supplemental oxygen right away. If this person has has already been prescribed medication for asthma treatment, then if they're not using it or they don't know how to use it, we're going to have them use it right away. We're going to teach them how to use it. Getting a patent airway is the main priority for an asthma attack, for a patient who is going through an asthma attack. The patient, if the patient does not know how to use the inhaler, like I said, we are going to help them. We're going to teach them. And the other priority would be to get the patient away from whatever is triggering that asthma attack as well, and teach the patient accordingly. What are some of the medications used to treat asthma? There's long-term medications for asthma like inhaled corticosteroids such as beclomethasone. Leukotriene modifiers can help prevent symptoms for up to 24 hours, and that's the medication called montelukast. Bronchodilators, long-acting beta agonist medications open the airway and reduce the swelling for at least 12 hours. They are used on a regular schedule to control moderate to severe asthma and to prevent nighttime symptoms. Theophylline, you take this bronchodilator daily. It comes in a pill, and to treat mild asthma symptoms. And then there's a combination of inhalers such as corticosteroids and long-acting beta agonist bronchodilators. Medication names for those would be fluticasone and salmeterol. There's also the quick relief medication such as albuterol, as referred to as a rescue inhaler during asthma attacks. What would be important to teach the patient with asthma in order to prevent some of these asthma attacks? If you have asthma, you must learn how to take your medications as prescribed. The time that it was prescribed, how it was prescribed. If you don't know that, then you must teach the patient how to do that. You have to learn how to monitor your asthma. What are some of the symptoms, early symptoms that you feel? What are some of the things that you can expose yourself to that is going to bring about some of these symptoms? You got to be able to detect some of those early changes and then be able to understand if some of the symptoms are actually worsening, for you to know what to do. There will be a combination of medications that you will have access to in order to manage those symptoms. You have to make sure that you always have your rescue inhaler with you. when you're out and about, because you don't know what you're going to be exposed to, and it may trigger an asthma attack, and you have to use that as prescribed as well. Dust. What are some of the things in your own home that can trigger an asthma attack? Where you sleep, cleaning your house, like, if you vacuum, you're picking up dust. You have to use certain types of filters for your vacuum cleaner that will prevent that, or avoid using a vacuum cleaner at all. But you must clean the house, because you cannot let the dust accumulate, based on the fact that you shouldn't be vacuuming, but you cannot have a lot of dust. You got to stay away from pets. You have to recognize what it is that causes you to have these asthma attacks. What are the triggers? Is it the outdoors? Is it there a plant that you have in your home, in your yard? Is there something at the park that makes that happen? Is there the air in the area where you live, depending on the industry or depending on the pollution? So all those things you have to take into consideration and learn, and be able to identify what it is that's causing you to have asthma attacks. If you're a smoker, then you're gonna want to quit smoking. If there's people smoking in your house, you must stay away and avoid exposure to secondhand smoking as well. And once again, continue to learn what are the triggers, and they can change. They can actually change. If from time to time you may not be affected by certain things, but as time goes on, possibility would be that you may be affected by it. What are some of the community resources available for people with asthma? In my area, there's the Arizona Asthma Coalition, the Arizona Department of Health Services, American Lung Association of Arizona, AXIS, Ashline to Quit Smoking, Asthma Athletics, and Banner Children Hospital Support Group. These are all resources that people with asthma can utilize if they have the need. And this is my presentation for the lungs and how they're affected by asthma. Thank you.